call functional medicine for 14 years, which actually makes me an old timer in the world of functional medicine. Now, when I started practicing 14 years ago, we didn't call it functional medicine. A lot of practitioners called themselves holistic medicine practitioners. What happened was people who were not licensed healthcare providers started calling themselves holistic medicine practitioners. And then we had to develop some regulating or governing boards. So that's one thing that Becky asked me on her podcast when I was a guest speaking about Hashimoto's, which is an autoimmune disease. It's the most common autoimmune disease in the United States. It is estimated that it affects 26% of the population. And 90 to 95% of men and women who have hypothyroidism because they have Hashimoto's. So we're not here to talk about Hashimoto's and autoimmune disease, but you know that this is a safe place to eat if you have autoimmune disease. If you're on a specialty diet, such as a gluten-free, a grain-free, a gluten and dairy-free diet, this is a safe place to eat, to feel like a human, to come together, be able to meet your friends and family for lunch or for dinner. This is a safe place that I often eat, bring my family, and network with other functional medicine practitioners. And Becky will tell you, we have events coming up in July and in August where I am actually hired by one of the largest nutrigenomic companies in the United States to train physicians on how to implement nutrition and functional medicine into their practices. So the question I get a lot is, how do you know somebody's a functional medicine practitioner? Well, I certainly hope we don't walk around calling ourselves functional medicine practitioners without some type of education or certification to back that up. So one great resource for you guys is ifm.org, which is the Institute of Functional Medicine. The Institute of Functional Medicine is like the Harvard of training physicians how to practice and implement functional medicine into their practices. And you do have to be a licensed healthcare provider to enroll at IFM. So you can have MDs or medical doctors, DOs, which are doctors of osteopathy or osteopaths. You can have DCs, doctors of chiropractic. You can also be a PhD or a naturopathic doctor to go through this training. So right now you do have to be a licensed healthcare provider to go through this advanced training. Now it's interesting that I tell you guys to go to ifm.org. If you go to ifm.org right now, use their zip code finder, I'm not listed as a provider. And one of the reasons is, as I said, I'm an old timer, right? I started practicing functional medicine 14 years ago. There was no IFM at that time. But I remember being at seminars and seeing PhDs like Jeff Bland on stage, being at seminars and seeing Christy Hughes, which is a naturopathic doctor, on stage, speaking with them and networking with them. And now they have come together and started the Institute of Functional Medicine and teach for the Institute of Functional Medicine. I'm proud to say that IFM is not the only way for a practitioner to get trained or certified in clinical nutrition or in functional medicine. Me, for example, I hold a diplomate in clinical nutrition from the American Institute of Integrative Medicine. Okay, now integrative medicine and functional medicine are one and the same. They are the same thing. I just met with a rep for a nutrition company earlier this week, and she said to me, I see functional medicine practitioners as doctors who get to the root cause, that do functional testing. And I see integrative medicine practitioners as people who integrate traditional and alternative methods. And I said to her, they're the same thing, okay? So I call myself an integrative medicine practitioner technically because my diplomate is from the American Institute of Integrative Medicine. For the last 6 years, I've had a provider at my office who was a certified functional medicine practitioner, CFMP. It's an actual certification. You have to do a lot of training and you have to pass tests to be a CFMP. One of the other doctors at my office, Dr. Anthony Pasek, who's here with us this evening, he's trained through the Carrick Institute, which is another functional medicine program that focuses on brain health, brain function, and neurology. There's another organization out there called A4M, which is the American Academy of Anti-Aging Medicine. So there's many institutions out there, but essentially you have to be a licensed healthcare provider to go down these roads for this advanced training. Why? Because the average medical doctor gets 2 credit hours of nutrition when they're in medical school. I did not know this. How I found this out was I work with a brilliant functional medicine cardiologist here in the St. Louis area. And he called my office one day and asked to speak with my front desk girl and asked if he could come to the office and meet me for lunch. And I'm thinking, oh geez, what's this gonna be about, right? So it just so happened he was the cardiologist to one of my patients. And her labs were going down quickly. Her diet was amazing. Her supplement intake was very clinical and clinically appropriate for this case. And he thought to himself, where did she get trained? I want to learn more about this. So we had a conversation and he said to me, I said, why did you reach out to me? And he said, because I kept thinking that my nutrition education was going to come. I went through my cardiology program, my residency. He was chief of staff at a hospital with 2 hours of nutrition education. And I thought to myself, are you kidding me? You can become a cardiologist or an endocrinologist with 2 hours of nutrition education? You can. The other issue we run into is naturopathic doctors have hours and hours and years of training in nutrition and what we call functional medicine. But state to state, regulations are different. State to state, insurance reimbursement's different, right? Naturopaths are not regulated in the state of Missouri. So we choose to live in a state where the people who are the most qualified to practice functional medicine cannot practice because they cannot get licensed in this state. That's a problem, right?
So I studied with a naturopath for 2 years, and I had no idea that this was way before.
So I'll tell you, so long time ago, I suffered with my own health issues. I suffered with digestive issues my entire life. When I was 10 years old, my mother was diagnosed with cancer for the first time. And her best friend happened to be an oncologist. So I looked up to him, and I knew when I grew up, I wanted to be a doctor. I didn't know what type of doctor, I just knew I wanted to be a doctor. So I suffered with digestive issues my whole life, and my mom was a good mom, and she took me to the best doctors. And I was a good patient, and I did everything I was told. And I remember over and over, like it was yesterday, my mom was asking these doctors if my diet could be connected to why I had chronic digestive issues. And I heard over and over, it has nothing to do with it. It has nothing to do with it. So when you're looking for a functional medicine practitioner, the very first question I would ask if I were you is, do you believe diet and lifestyle has anything to do with my health? And if they say no, you can do what you're gonna do, but I would run. I would run. Because I'm gonna tell you right now, I have doctors. My family has doctors. My kids see a doctor. My husband goes to a doctor. And every single doctor in my life, in my family's life, shares the same philosophy as me when it comes to healthcare. And that is that your diet and lifestyle profoundly impacts your health and how you feel, okay? Because deficiency and toxicity is a very real problem among Americans. Now, how do we detect deficiency? You test for it. This is not rocket science. This is not voodoo. This is not quackery. You do the right tests. Testing for common deficiencies like B12, folate, iron, ferritin, and vitamin D is not ridiculous, unnecessary, or expensive. It's how you get to the root cause of symptoms. Because being told it's in your head, or you need to cut your calories, or you need to work out more, or do more, eat less, push harder, it's making us sicker. It's making us sicker. And one thing I hear over and over again is patient stories telling me, I asked for this testing and I couldn't get it ordered. Well, guess what? You're responsible for your own health, and believe it or not, you can order your own testing. You can order your own testing. So it's not about trying to turn atheists into believers. It's about taking responsibility for your own health and getting your hands on the testing that you need to identify the root cause of your issues. So the first question I have you ask when you're interviewing or trying to find a functional medicine practitioner is, do you believe diet and lifestyle has anything to do with my health? The second thing, it's okay to ask for credentials, guys. I've never in my life been offended when somebody asked my credentials. My credentials are all over the place, guys. I've got a bachelor's degree in biology, a doctorate in chiropractic, I'm board certified in Chinese medicine, I have a diploma in clinical nutrition. I could sit here and spend 10 minutes on my credentials and I would never be offended if somebody asked me that. So, another thing I think is important when you're finding the right functional medicine practitioner is we've got to set ego aside and be humble enough to say, I don't know. I'm going to briefly tell you a story, and you guys can judge who is the better healthcare provider. I am not judging them. I can give you my opinion. I'm just going to tell you this story. So I have a patient who has a gene mutation called MTHFR, and she's been consulting with several physicians before she came to see me recently. She was working with two physicians. One was her primary care, and she said to him, I have MTHFR. Do you know anything about this? Can you order a homocysteine test on me? And he said, I'm going to be totally honest with you. I'm not trained on MTHFR, and I'm not trained on homocysteine levels. Now, just to be totally honest with you, I'm having my son tested for MTHFR because I've been reading a lot about it, and I believe he has it. So this is physician number one. Physician number two claims to be a functional medicine practitioner, I don't know credentials, and says to this patient, I'm a good functional medicine practitioner because I don't sell supplements, and proceeds to tell her patient to buy their supplements online, and referred her patient to buy cyanocobalamin and folic acid online, which is contraindicated with MTHFR. So who's the better doctor, right? I'm not judging, I'm just saying what we have to do is be humble enough to say, I don't know. I had a patient today who's been to 3 functional medicine practitioners, and these people have some serious street credit, especially in this local community. And nobody's run a stool analysis on her. She has an autoimmune disease, and the first thing I said to her is, we need to do a stool analysis. I need to see what's going on in your gut and what's going on with the immune cells within your gut. And so she looked at me, we reviewed her testing, and I said, you have leaky gut. And a lot of people walk in my office and say, I have leaky gut. I'm like, okay, show me the testing. Oh, I haven't been tested. Then how do you know you have leaky gut, right? How do you know? You don't know unless you have elevated zonulin levels. So we ran a stool analysis on her. Sure enough, she has leaky gut. And she said to me, how did this happen? How did I get leaky gut? And do you know what my answer was? I don't know. I don't know. I could tell you the different things that lead to leaky gut. I could tell you the different causes of leaky gut, but I'm not going to sit here and lie to you and tell you I have a crystal ball and I know how you develop leaky gut. I don't know, right? So I think saying I don't know in healthcare is okay. I think saying I'm not trained is okay. But the third thing I think that makes a functional medicine practitioner great is the relationships you have with other practitioners within your community, right? Because if I refer a patient out to another functional medicine practitioner that may be a cardiologist or a rheumatologist or a gastroenterologist, I have to have a pretty good reason to refer them out. But that patient's outcome is going to be so much better because I communicate with that doctor before I refer them. I let that doctor know what I'm doing with them, and then after that doctor sees them, guess what they do? They follow up with me. That's called synergy. That's called 2 people working together on your behalf. When you have somebody telling you things, making you feel wrong for your choices, making you feel wrong for your beliefs, find somebody else. Because I'm going to tell you, at the end of the day, you know who we work for? Who do we work for? You. You came to me and you hired me to guide you to better health. You want to feel listened to and heard, and my job is to be a detective and order the right tests on you, right? To help identify the root cause of why you're having these symptoms. And if I can find those issues, I will let you know, and then I will teach you how to correct them with diet, with lifestyle, sometimes with supplementation, okay? Because I don't believe we can get all of our nutrients just through diet, and here's why. Because we live in a very toxic world. We're dealing with toxicity all the time. And every time we take a medication, it depletes nutrition. So we're actually creating deficiencies by doing things like drinking soda. We're creating deficiencies by certain medications. We know this to be true. So how are we going to get all of our nutrition just from food when our food doesn't have the nutrient content that it did 30 years ago? When we're being exposed to more toxins in our environment, in our food, in our water than ever before. Deficiency and toxicity is a very real problem in America. And if we pretend it's not, then we're choosing to look the other way and be ignorant or oblivious to what is really happening. Okay? The United States is a wonderful country. It is a huge country. But yet, we manage to rank between number 33 and 38 in terms of health in the world. There are third world countries that rank healthier than the United States. I believe it was in 2017, France was ranked the number 1 healthiest country in the world. Guys, they eat bread, they drink wine, and they smoke cigarettes all day, every day. And they were number 1, and we can't figure this out. But we continue to say diet and lifestyle's got nothing to do with it. Or we continue to say that's fake, that diagnosis is fake. Like Hashimoto's. Do you know how I literally saw a patient yesterday who said my primary care referred me to an endocrinologist because I had hypothyroidism and she wanted me to have more testing. This person went in, saw the endocrinologist. This person's autoimmune markers came back high. So then the endocrinologist referred her to the rheumatologist because autoimmune issues are different than endocrine issues. She gets to the rheumatologist. The rheumatologist says to her, "You have Hashimoto's." She goes back to the primary care and tells her primary care, "I went to the endocrinologist sent me to the rheumatologist said I have Hashimoto's." And then the primary care said, "You don't have Hashimoto's. That rheumatologist tells everybody they have Hashimoto's." And I think to myself, this is not the tooth fairy. This is black and white. If you have elevated thyroid antibodies, you have antibodies attacking your thyroid, right? If you have antibodies attacking your joints, we don't say, "Oh, it's fake, don't worry about it." You have rheumatoid arthritis, right? So what autoimmune disease is when your immune system is hyperactive and attacking something. And it just so happens that Hashimoto's is the most common autoimmune disease in the United States, not in the world. So that's my 2 cents on functional medicine and how to find a functional medicine practitioner. There are a lot of great organizations out there. And I have to give kudos to SLIM, which is St. Louis Institute of Integrative Medicine. I will tell you, it's slim.org. The gal who founded SLIM, Kristen Brokaw, who is a representative for Orthomolecular, I met her probably 9 years ago, maybe 10, when I started practicing here in the St. Charles County area 11 years ago. And her and I were talking, and I was recruiting like-minded doctors to meet for lunch once a month. And I had in this group, I had a rheumatologist, I had a medical doctor, I had pharmacies, I had health food stores, people who were very interested in root cause and food as medicine. People who understood supplementation and proper testing. So we would meet and have this lunch, and Kristen said to me, "Hey, I'm organizing this group called SLIM." So I started attending these SLIM meetings 9 or 10 years ago, and there was like 10 to 15 of us. We now have about 40 to 50 active members in SLIM in a variety of different specialties. So I really have to give her kudos. She put together a phenomenal organization for us to get together and network and mastermind so we can build relationships and help our patients. But sometimes we have to take it to another level. So I actually am part of a mastermind group with functional medicine practitioners across the United States, because I would love to tell you we have the most advanced functional medicine here in the St. Louis area, but I would be lying to you, okay? I have patients reaching out to me all over the country that live in areas where they cannot find a functional medicine practitioner. And we need more and more people to get trained on this. This is a huge reason why I've implemented telemedicine or virtual practice into my practice. Not because I had any interest in taking care of people in rural Missouri, but because people in rural Missouri deserve to get good health care. So I want to thank you for giving me your attention over these last 20-ish minutes or so. I never time myself, but I'm usually pretty close. I'm going to turn off the recording and I'm going to answer any questions that you guys have.